Okay, I'm starting. Okay. Hello. Yeah. Very good afternoon, everybody. I'm Dr. Sujoy, consultant gynecologist and infertility IVF specialist. Today, we are going to discuss about PCOS, polycystic ovary syndrome. Okay. You probably have heard about PCOS. It's a growing problem in our society. Many girls and women are regularly affected. Okay. But what is PCOS? Many people hear that PCOS is actually the disease, is basically the condition of a cyst. Please remember, PCOS is not the disease of the cyst. Rather, PCOS is an hormonal disorder. What happens in PCOS? Normally, inside the ovaries, there are something called follicles. These follicles are fluid-filled structures which contains the eggs. And these eggs usually become mature and ovulate. That is, these eggs are released from the ovaries. And if they are ovulating, then it can lead to pregnancy. If pregnancy cannot happen, then there will be periods, that is menstruation. In PCOS, there are more than usual number of follicles. That is more than usual number of eggs in the ovaries. But these follicles cannot ovulate. That is, eggs are not released. As a result, there is difficulty in getting pregnant and periods do not happen regularly. Sometimes women are coming with us with the report suggesting polycystic ovary and they are very much worried, oh doctor, I'm having PCOS. Please remember, just because your ultrasound is showing that you are having polycystic ovary, that does not mean you are having PCOS, polycystic ovary syndrome. There is difference between polycystic ovary and polycystic ovary syndrome. What's the difference? In PCOS, there should be at least 2 out of these 3 features. Number 1 feature is irregular periods. Number 2, you should have excess testosterone in blood, or you should have excess hair growth like facial hair like male, or excess body hair, or elevated testosterone level. And you should have polycystic ovary in ultrasound. Therefore, 2 out of these 3 should be present. If you have only polycystic ovary in ultrasound, but your periods are regular, you don't have any excess hair growth or testosterone are normal, then you do not have PCOS. Now, if you have PCOS, what you have to do? Please remember, PCOS is not totally curable. Okay, you not like this point that PCOS is not curable, but remember, PCOS is a chronic disease, like diabetes, like hypertension, like thyroid disease, which are chronic diseases. Similarly, PCOS is chronic disease. It's not curable, but it can be kept under control. You keep it under control. What problem arises? Number 1 is regular. Number 2 may be difficult getting pregnant, and even after you get pregnant, there may be increased risk of miscarriage. There is increased chance of pregnancy complications like some diseases, preeclampsia, increased blood pressure in pregnancy, gestational diabetes mellitus, that is elevated blood sugar in pregnancy. And apart from that, when you grow older, you can have high blood pressure, hypertension, diabetes, high blood pressure, and high blood sugar, and it can lead to heart disease, stroke, and even sometimes cancer and liver disease. Sometimes fat may be deposited in your neck, and it can bring troubles, etc. But PCOS can be kept under control, and for most of the time, to keep PCOS under control, you don't need to take any medicine. Simple lifestyle measures are sufficient. That is, weight changes, weight loss by diet and exercise. Both are important, diet and exercise. Okay. If you manage to keep your weight normal, and particularly if you do not have any fat deposition in your tummy, then most of the problems can be solved. We find that even 5 kg of weight reduction can help you getting pregnant without any medication. So first line of treatment of PCOS is weight control, lifestyle changes. The next treatment depends on what a patient wants, or what for a patient comes to us. If a patient came to us with infertility, then we have to look for the other causes of infertility and go for the treatment. If the patient's problem is only irregular periods, then we'll have to treat the irregular periods because fertility is not a concern. If the patient's problem is simple excess hair growth, then we have to treat this hair growth. Okay. Now, how we can treat irregular period in a woman who is not interested in fertility or who does not want to get pregnant? In that case, we can advise simple contraceptive pills. Please remember, there are many myths and misconceptions about contraceptive pills. Contraceptive pills are absolutely safe. They do not cause weight gain. They do not cause cancer. So we give contraceptive pills until the lady is ready to get pregnant. And contraceptive pill in the long term does not affect your chance of pregnancy. So contraceptive pill will prevent pregnancy so long you are continuing it. Whenever you want to conceive, you can stop contraceptive pill. So contraceptive very well PCOS in women who not wants to conceive. Now next thing is that some medicine which usually prevent pregnancy, but remember this medicine may take 6 months of time to show its effect on hair growth. Therefore, if you are taking medicine for excess hair growth or hirsutism, you have to wait for 6 months. If after 6 months we find that this medicine is not acting, then we can change the other type of medicine. Now the greatest problem with PCOS is infertility. Many women PCOS are having difficulty in conceiving. But the good thing is that most of these PCOS women with infertility can conceive naturally or with simple medicines without any advanced treatment. Now, what can you do? If you have infertility, if you are trying for pregnancy, and if you are having PCOS, what we can do? Firstly, we ask the woman, please try for at least 4 to 6 months, because before 4 to 6 months, we should not go for infertility investigation and treatment. Otherwise, there is chance of over treatment. You may need unnecessary treatment. That's why you have to wait for at least 6 months. If pregnancy does not happen, then we have to look for other possible causes, whether there are any other possible factors apart from PCOS, like we have to look for your partner or your husband's sperms, and also we may need to check the condition of your fallopian tubes. If these are okay, again, we will always emphasize on weight control as the first line of treatment. If even after weight control you cannot conceive, we have to go for the treatment called ovulation induction. That is, we have to give medicine for ovulation induction. Remember, if you are taking the medicine for ovulation inductions, 2 things are important to do. Number 1, you should have regular intercourse with your partner for at least 2 to 3 times a week. And secondly, if you are taking this medicine, at least in the first cycle, you should go to your doctor for TVS follicular study. That is a special type of ultrasound. We do the ultrasound by TVS, that is vaginally, because in that case, we can understand the condition of ovaries and tubes in better way. And we see how the follicles are growing with respect to the response to the doctor, response to the medicine. That is how you are responding to the medicine. If the medicine is working, then, and you are having regular intercourse, then in that case, the chance of pregnancy in 1 month is only 15%. That is, if 100 women are taking this medicine and 100 women have undergone TVS follicular study, which have shown that you are ovulating, and you have regular contact with your husband, then out of 100 in 1 month, 15 can conceive. Therefore, it's very important to see by follicular study whether you are ovulating or not. If you are not ovulating with that medicine, there is no use of continuing the same medicine again and again. In that case, we have to change the medicine, we have to shift to other medicine. But if the medicine is working, we advise the couple to try this oral medicine for at least next 4 to 5 months. If that fails, then we can try injection called gonadotropin injection, and then we can try ovulation induction for next 3 to 4 months. But remember, ovulation induction should not be taken for more than 6 to 8 months, because most of the women who conceive with ovulation induction, they conceive within 6 to 8 months. Therefore, ovulation induction should not be continued for more than 6 to 8 months. But how long you can continue ovulation induction depends on your age, the condition of your husband's sperm, condition of your tubes, and how long you are planning for pregnancy. Apart from ovulation induction, sometimes we are giving some medicine called metformin and inositol. They are given to increase the sensitivity of insulin. What is this? You know, insulin is a hormone secreted by pancreas. It controls your blood sugar. In PCOS, insulin cannot act properly. Therefore, there is risk of elevated blood sugar. That's why we give metformin, sometimes we give inositol. There are again misconceptions about metformin. If we give metformin, patients are asking, doctor, I'm having normal blood sugar. Why you are given metformin? Remember, metformin can be given even when your blood sugar is normal, because it cannot reduce the blood sugar if you have normal blood sugar. So don't worry. Rather, metformin can increase the chance of pregnancy. Now, if after 6 to 8 cycles of ovulation induction, you cannot conceive, in that case, what we do IUI, intrauterine insemination. We give you medicines and injections to help your eggs to grow. If that fails, then we are collecting your partner's sperms, husband's sperms, and process it and put it inside your uterus with a special catheter. And this is called IUI. The success rate of IUI per cycle is 15 to 20%. That is, if 100 women are undergoing IUI in one cycle, 15 to 20 can conceive. But IUI should not be continued for more than 3 to 4 cycles, because women should conceive within 3 to 4 cycles of IUI. If that fails, the final option is IVF or IVF in vitro fertilization, which is commonly known as test tube. What we do here, we give you injection to help your follicles to grow. If the follicles are growing to a certain size, then we take you to the theater, operation theater, and put a needle inside your vagina and collect the eggs from your ovaries. Then in the laboratories, fertilization is done. That is, eggs are made with your husband's sperms. Then embryos are formed. Then embryos are transferred inside your womb. In case of polycystic ovary, there is special risk when we are going for ovulation induction or IUI or IVF. That is called ovarian hyperstimulation syndrome, OHSS. What is this? In PCOS, ovaries do not want to respond to small dose of medicine. If you give small dose, it cannot respond. However, we have to be very careful in increasing the dose of gonadotropin, because if we suddenly increase the dose, large number of eggs can develop, and it can be sometimes harmful, because it can lead to accumulation of fluid in your tummy, in your chest, etc. It can lead to vomiting, it can lead to bleeding troubles. That is called ovarian hyperstimulation. That is, there is risk that you can respond excessively than what is expected. That's why we have to be very cautious, and we have to be careful, and we have to do serial follicular study. And similarly, there is increased risk of multiple pregnancy, like having more than one baby if you conceive, like twin or triplet, which carries higher risk to mother and baby. Therefore, we have to be cautious about it. But most of the women with PCOS, they do not require IUI or IVF, and majority of them can conceive naturally if husband's sperms and all other parameters are normal. Now, sometimes women are asking, doctor, when I should go for laparoscopy. Remember, laparoscopy is an operation. What we do, I have mentioned that polycystic ovary syndrome is not the disease of the cyst. So what will you do by laparoscopy? In laparoscopy, using special current, electric current, we burn some of these follicles, polycystic ovaries, so that you can have spontaneous ovulation. But remember, if you are planning for laparoscopy, be cautious, because if laparoscopy is not done judiciously, it can do more harm than good. That is, it can damage the ovaries, and you can land up in early menopause, and it can further damage the tubes and other structures. So that's why we have to be careful. Therefore, laparoscopy should only be done if you do not want to go for IUI or IVF, if your weight is normal, if you are quite younger, less than 30 years of age. And remember, don't forget to do your blood test for LH and AMH before doing laparoscopy. If LH and AMH are high, then only laparoscopy can help. If LH and AMH are normal or low, then please don't go for laparoscopy, because it can do more harm than good. Remember, if you conceive after PCOS, still there are risks of having gestational diabetes and miscarriage. So be careful, take care of you, and talk to your doctor regularly for your regular checkup. Okay, so don't forget it. We'll take some questions. Number one, will PCOS delay pregnancy? As I mentioned, PCOS may delay pregnancy, but with treatment, most of the women with PCOS can conceive. Do I need to take a birth control pills? If your periods are irregular and you are not planning for pregnancy, in that case, you should consider taking birth control pills. If I'm insulin resistant, how will it affect my treatment? If you are insulin resistant, then we have to give metformin and inositol. These are required. Should I lose weight? Of course, as I've mentioned, that weight loss is the first treatment. How can I lower the risk of complication? As I've mentioned, the lifestyle changes, diet and exercise, both are important. How will PCOS affect my fertility? As I mentioned, because the eggs are not released, ovulation is not happening. That's why you can have fertility problem. Treatment of PCOS already discussed, depends on what problem you are facing right now, whether you are having fertility problems or you are just having irregular periods or not. Managing symptoms with PCOS, as I mentioned, weight control and symptomatic treatment, fertility treatment or birth control pills. How can I get rid of PCOS? Remember, PCOS cannot be cured. We have to live with PCOS, but you can control it. Okay. Now, what should not I eat? Should I not eat with PCOS? As I may avoided, particularly the red meat, wine, the fast food, junk food, etc. But you should take plenty of green leafy vegetables and fruits. Okay, these are required, and at the same time, you should do some exercise. Okay. So PCOS is there. PCOS is not curable, but it can be kept under control. So, any other queries from anybody? Okay, then I think we can finish. Okay, thank you very much.